NCLEX RN Practice Test, Set 2, 30 questions, let's begin. Question number 31. A client has a prescription for valproic acid 250 mg once daily. To maximize the client's safety, which time is best for the nurse to schedule administration of the medication? A. With lunch, B. With breakfast, C. Before breakfast, D. At bedtime with a snack. Answer, letter D, at bedtime with a snack. Valproic acid is an anticonvulsant that causes central nervous system, CNS, depression. For this reason, the side and adverse effects include sedation, dizziness, ataxia, and confusion. When the client is taking this medication as a single daily dose, administering it at bedtime negates the risk of injury from sedation and enhances client safety. Otherwise, it may be given after meals to avoid gastrointestinal upset. Priority nursing tip: if the client is taking a CNS depressant, inform the client that sedation can occur and of the measures that ensure safety. Question number 32. Which findings documented in the history of an older client should require the nurse to implement an accident prevention protocol? Select all that apply. A. Range of motion is limited. B. Peripheral vision is decreased. C. Transmission of hot impulses is delayed. D. The client reports incidences of nocturia. E. High-frequency hearing tones are perceptible. F. Voluntary and autonomic reflexes are slowed. Answer, letter A, B, C, D, F. The physiological changes that occurred during the aging process increased the client's risk for accidents. Musculoskeletal changes include a decrease in muscle strength and function, less in joint mobility, and limited range of motion. Sensory changes include a decrease in peripheral vision and lens accommodation, delayed transmission of hot and cold impulses, and impaired hearing as high-frequency tones become less perceptible. Nervous system changes include slowed voluntary and autonomic reflexes. Genitourinary changes may include nocturia. Priority nursing tip: age-related changes occur on an individual basis, and one client may experience an age-related change to a lesser extent than another client. The nurse must gather baseline data and then assess for changes and determine the appropriate course of action to compensate to promote client safety. Question number 33. Which actions should the nurse take when obtaining a sputum culture from a client with a diagnosis of pneumonia? Select all that apply. A. Explain the procedure to the client. B. Obtain the specimen early in the morning. C. Have the client brush his teeth before expectoration. D. Instruct the client to take deep breaths before coughing. E. Place the lid of the culture container face down on the bedside table. Answer, letter A, B, C, D. The nurse always explains a procedure to the client. The specimen is obtained early in the morning whenever possible because increased amounts of sputum collect in the airways during sleep. The client should rinse the mouth or brush the teeth before specimen collection to avoid contaminating the specimen. The client should take deep breaths before expectoration for best sputum production. Placing the lid face down on the bedside table contaminates the lid and could result in inaccurate findings. Priority nursing tip: any specimen for culture needs to be collected via sterile technique because contamination of the specimen invalidates the results. Question number 34. The nurse should plan to wear this protective device when caring for hospitalized clients with which diagnosed disorders. Refer to the figure, select all that apply. A. Scabies, B. Tuberculosis, C. Hepatitis A virus, D. Pharyngeal diphtheria, E. Streptococcal pharyngitis, F. Meningococcal pneumonia. Answer, letter D, E, F. A standard surgical mask is used as part of droplet precautions to protect the nurse from acquiring the client's infection. Droplet precautions refer to precautions used for organisms that can spread through the air but are unable to remain in the air farther than 3 feet. Many respiratory viral infections such as respiratory viral influenza require the use of a standard surgical mask when caring for the client. Some other disorders requiring the use of a standard surgical mask include pharyngeal diphtheria, rubella, streptococcal pharyngitis, pertussis, mumps, pneumonia, including meningococcal pneumonia, and the pneumonic plague. Scabies and hepatitis A are transmitted by direct contact with an infected person and require the use of contact precautions for protection. Tuberculosis requires the use of airborne precautions and the use of an individually fitted particulate filter mask. A standard surgical mask would not protect the nurse from Mycobacterium tuberculosis. Priority nursing tip: infection control is very important to implement when caring for clients. Nosocomial, or hospital-acquired infections, can be prevented if these practices are properly implemented. In-service educational sessions are effective ways to remind healthcare workers of proper precautionary procedures. Question number 35. The nurse is developing a hospital policy on guidelines for telephone and verbal prescriptions. Which guidelines should the nurse include in the policy? Select all that apply. A. Avoid using all abbreviations. B. Verbal prescriptions are rarely acceptable. C. Clarify any questions with the primary healthcare provider. D. Repeat the prescribed prescriptions back to the primary healthcare provider. E. Co-signing the prescription by the primary healthcare provider is not necessary. EF. If the prescriber is the client's primary healthcare provider, documentation is unnecessary. Answer, letter C, D. To avoid misunderstandings, the nurse would always clarify a telephone or verbal prescription with the healthcare provider, HCP, if he or she had any questions about the prescription, and would repeat any prescribed prescriptions back to the HCP. A telephone order, TO, or prescription involves a primary HCP stating a prescribed therapy over the phone to the nurse. TOs are frequently given at night or during an emergency and need to be given only when absolutely necessary. Likewise, a verbal order, VO, or prescription is acceptable when there is no opportunity for the HCP to write the prescription, such as in an emergency situation. Additional guidelines for telephone and verbal prescriptions include the following: clearly determine the client's name, room number, and diagnosis. Indicate TO or VO, including the date and time, name of the client, complete prescription, name of the HCP giving the prescription, and nurse taking the prescription, and have the HCP co-sign the prescription within the time frame designated by the healthcare agency, usually 24 hours. Priority nursing tip: the nurse plays a vital role in maintaining the safety of the client. The nurse is considered the last line of defense for clients in terms of noting a prescription that may be harmful to them. Question number 36. The nurse employed in a preschool agency is planning a staff education program to prevent the spread of an intestinal parasitical disease. Which prevention measure should the nurse include in the educational session? A. All food will be cooked before eating. B. Only bottled water will be used for drinking. C. All toileting areas will be cleansed daily with soap and water. D. Standard precautions will be used when assisting children with toileting. Answer, letter D. Standard precautions will be used when assisting children with toileting. The fecal-oral route is the mode of transmission of an intestinal parasitical disease. Standard precautions prevent the transmission of infection. Some fresh foods do not need to be cooked as long as they are washed well and were not grown in soil contaminated with human feces. Water and fresh foods can be vehicles for transmission, but municipal water sources are usually safe. Cleaning with soap and water is not as effective as the use of bleach. Priority nursing tip: regardless of the infectious agent, infection control measures are essential to protect primary healthcare providers and clients. Question number 37. A client has arrived at the labor and delivery unit in active labor. The nursing assessment reveals a recurrent history of diagnosed genital herpes and the presence of lesions in the genital tract. Which intervention should the nurse initiate? A. Limiting visitors, B. Maintaining reverse isolation, C. Preparing for a cesarean delivery, D. Preparing for the artificial membrane rupturing. Answer: letter C, preparing for a cesarean delivery. A cesarean delivery can reduce the risk of neonatal infection with a mother in labor who has herpetic genital tract lesions. There is no need to limit visitors or maintain isolation, although standard precautions should be maintained. A vaginal delivery presents a risk of transmitting the disease to the neonate. Intact membranes provide another barrier to transmitting the disease to the neonate. Priority nursing tip: no vaginal examinations are performed on a pregnant woman who has active vaginal herpetic lesions. Question number 38. Which interventions should the nurse perform when inserting an indwelling urinary catheter in order to maintain both the integrity of the catheter and the client's safety? Select all that apply. A. Use strict aseptic technique. B. Place the drainage bag lower than the bladder level. C. Inflate the balloon with 4 to 5 milliliters beyond its capacity. D. Swab the urinary catheter with sterile water before inserting. E. Advance the catheter 1 to 2 inches after urine appears in the tubing. Answer: letter A, B, E. The nurse would use strict aseptic technique to insert the catheter. The drainage bag is placed lower than bladder level to ensure drainage, prevent retrograde flow of urine, and reduce the risk of infection. Advancing the catheter 1 to 2 inches beyond the point where the flow of urine is first noted is also good practice because this ensures that the catheter balloon is completely in the bladder before it is inflated. The nurse risks rupturing the catheter's balloon by overinflating it, therefore, the nurse inflates the balloon with the specified volume for the catheter because inflating the balloon with 4 to 5 milliliters beyond its capacity is unsafe. The urinary catheter is sterile, so it is inappropriate and unnecessary to swab it with sterile water before inserting. Priority nursing tip: when preparing to insert a urinary catheter, it is advisable to bring an extra urinary catheter, an extra pair of gloves, and a flashlight along with the regular urinary catheter insertion equipment to the client's room. Question number 39. A client admitted 2 days ago with a diagnosis of moderate depression begins smiling and reporting that the crisis is over. Which priority modification to the treatment plan should occur based on the behavioral cues of the client? A. Allowing off-unit privileges PRN B. Suggesting a reduction of medication C. Allowing increased in-room activities D. Increasing the level of suicide precautions. Answer: letter D. Increasing the level of suicide precautions. A client who is diagnosed as moderately depressed and has only been hospitalized 2 days is unlikely to have such a dramatic cure. When a mood suddenly lifts, it is likely that the client may have made the decision to cause self-harm. Suicide precautions are necessary to keep the client safe. Options A and B are incorrect because they support a quick cure. In-room activities do not encourage social interaction. Social interaction would be a desired outcome for a moderately depressed client. Priority nursing tip: when a client diagnosed with moderate depression at risk for suicide displays increased alertness and energy, suicide precautions should be continued. These observations are an indication that the client has the energy to perform the act of suicide. Question number 40. The nurse is planning care for a client admitted with suicidal ideations. To best assure client safety, the nurse will implement additional precautions during which time period? A. During the day shift, B. On weekday evenings, C. Between 8 a.m. and 10 a.m., D. During the unit shift change. Answer, letter D, during the unit shift change. At shift change, there is often less availability of staff. The psychiatric nurse and staff should increase precautions for suicidal clients at that time. The night shift also presents a high-risk time, as do weekends, not weekdays. Priority nursing tip: provide one-on-one supervision at all times for a client at risk for suicide. Question number 41. The nurse is assisting with the transfer of a client from the operating room table to a stretcher. Which interventions should the nurse implement to ensure client safety? Select all that apply. A. Check the client's level of consciousness. B. Check will locks of the operating room table. C. Complete the client transfer as quickly as possible. D. Tell the client to move self from the table to the stretcher. E. Raise side rails after the client is positioned on the stretcher per agency policy. Answer, letter A, B, E. As part of the safe transfer of a client after a surgical procedure, the nurse should assess the client's level of consciousness and, if appropriate, let the client know that she or he will be transferred from the operating room table to the stretcher. The nurse checks the wheel locks of the table and the stretcher to prevent any movement during the transfer. In addition, the nurse raises the side rails per agency policy to prevent the client from falling off the stretcher. This is important because the client is likely to be sedated or disoriented and unable to protect herself or himself from falling. Personnel avoid hurried movements and rapid changes in position because hurried movements predispose the client to hypotension. Moreover, secure, deliberate movement increases the security of the client. Because the client remains affected by anesthesia, the client should not move herself or himself. Priority nursing tip: the nurse should always obtain additional nursing staff assistance when moving a client or transferring a client from a bed to a stretcher or other location. Question number 42. The nurse is planning care for a suicidal client who is hallucinating and delusional. Which intervention should the nurse incorporate into the nursing care plan to best assure client safety? A. Check the client's location every 15 minutes. B. Begin suicide precautions with 30-minute checks. C. Initiate one-to-one suicide precautions immediately. D. Ask the client to report suicidal thoughts immediately. Answer, letter C. Initiate one-to-one suicide precautions immediately. One-to-one suicide precautions are required for the client rescued from a suicide attempt. In this situation, additional significant information is that the client is delusional and hallucinating. Both of these factors increase the risk of unpredictable behavior, compromised judgment, and the risk of suicide. Options A, B, and D do not provide the constant supervision necessary for this client. Priority nursing tip: never leave a client at risk for suicide alone. Question number 43. The nurse is planning care for a client with a prescription for anticoagulant agents. Which should the nurse identify as a potential concern for this client? A. Fatigue. B. Bruising. C. Infection. D. Dehydration. Answer, letter B, bruising. Anticoagulant therapy predisposes the client to injury because of the agent's inhibitory effects on the body's normal blood clotting mechanism. Bruising, bleeding, and hemorrhage may occur in the course of activities of daily living and with other activities. Options A, C, and D are unrelated to this form of therapy. Priority nursing tip: teach the client taking warfarin sodium to avoid consuming green, leafy vegetables and foods high in vitamin K because they interact with the action of the medication. Question number 44. A client reporting abdominal pain has a diagnosis of acute abdominal syndrome, but the cause has not been determined. Which prescription should the nurse question at this time? A. Clear liquid diet only. B. Insertion of a nasogastric tube. C. Administration of an analgesic. D. Insertion of an intravenous IV line. Answer: letter A. Clear liquid diet only. Until the cause of the acute abdominal syndrome is determined and a decision about the need for surgery is made, the nurse would question a prescription to give a clear liquid diet. The nurse can expect the client to be placed on NPO status and to have an IV line inserted. Insertion of a nasogastric tube may be helpful to provide decompression of the stomach. Pain management with medications that do not alter level of consciousness can decrease diffuse abdominal pain and rigidity, help with localizing the pain, and lead to more prompt diagnosis and treatment. Priority nursing tip: signs of perforation and peritonitis include restlessness, guarding of the abdomen, distension and a rigid abdomen, increased fever, chills, tachycardia, and tachypnea. Question number 45. A friend of the parents of a newborn with a diagnosis of congenital tracheoesophageal fistula contacts the home health nurse with an offer to help. Which is the best nursing action at this time to address the needs and rights of the family? A. Inform the friend to directly contact the family and offer assistance to them. B. Request that the friend come to the client's home during the next home health visit. C. Report the friend's call to the nurse manager for referral to the client's social worker. D. Assure the friend that there is no need for assistance since the nurse is visiting daily. Answer: letter A. Inform the friend to directly contact the family and offer assistance to them. The nurse must uphold the client's rights and does not give any information regarding a client's care needs to anyone who is not directly involved in the client's care. To request that the friend come for teaching is a direct violation of the client's right to privacy. There is no information in the question to indicate that the family desires assistance from the friend. To refer the call to the nurse manager and social worker again assumes that the friend's assistance and involvement are desired by the family. Informing the friend that the nurse is visiting daily is providing information that is considered confidential. Option A directly refers the friend to the family. Priority nursing tip: the nurse must protect client confidentiality at all times. Question number 46. The home health nurse is religiously opposed to homosexuality and cannot care for a client diagnosed with human immunodeficiency virus, HIV. The nurse then leaves the client's home. Which statement accurately identifies the nurse's rights and actions? Select all that apply. A. The nurse has the moral right to leave the client's home at any time. B. The nurse has a legal right to inform the client of any barriers to providing care. C. The nurse has a duty to protect self from client care situations that are morally repellent. D. The nurse has a duty to provide competent care to assign clients in a non-discriminatory manner. E. The nurse has the right to refuse to care for any client on religious grounds if competent care coverage is arranged. Answer: letter D, E. The nurse has a duty to provide care to all clients in a non-discriminatory manner. Personal autonomy does not apply if it interferes with the rights of the client. Refusal to provide care may be acceptable if that refusal does not put the client's safety at risk and the refusal is primarily associated with religious objections, not personal objection, to lifestyle or medical diagnosis. There is no legal obligation to inform the client of the nurse's personal objections to the client. The nurse also has an obligation to observe the principle of non-maleficence, neither causing nor allowing harm to befall the client. Priority nursing tip: the client always has the right to considerate and respectful care. Question number 47. The nurse is preparing to administer prescribed heparin sodium 5,000 units, subcutaneously. Which action should the nurse take to safely administer the medication? A. Inject via an infusion device. B. Inject within 1 inch of the umbilicus. C. Massage the injection site after administration for a full minute. D. Change the needle on the syringe after withdrawing the medication from the vial. Answer: letter D. Change the needle on the syringe after withdrawing the medication from the vial. After withdrawal of heparin from the vial, the needle is changed before injection to prevent leakage of medication along the needle tract. Heparin administered subcutaneously does not require an infusion device. The injection site is located in the abdominal fat layer. It is not injected within 2 inches of the umbilicus or into any scar tissue. The needle is withdrawn rapidly, pressure is applied, and the area is not massaged. Injection sites are rotated. Priority nursing tip: monitor the client receiving an anticoagulant for bleeding, such as bleeding gums, bruises, nosebleeds, hematuria, hematemesis, petechiae, and occult blood in the stool. Question number 48. A client asks the nurse to act as a witness for an advance directive. Which is the best intervention for the nurse to implement? A. Suggest the nurse manager as a witness. B. Agree to sign the document as a witness. C. Notify the provider of the client's request. D. Help the client find an unrelated third party. Answer: letter D. Help the client find an unrelated third party. An advance directive addresses the withdrawal or withholding of life-sustaining interventions that can prolong life and identifies the person who will make care decisions if the client becomes incompetent. 2 people unrelated to the client witness the client's signature and then sign the document signifying that the client signed the advance directive authentically. Nurses or employees of a facility in which the client is receiving care and beneficiaries of the client should not serve as a witness because of conflict of interest concerns. There is no reason to call the provider unless the absence of the advance directive interferes with client care. Priority nursing tip: if the client signs an advance directive at the time of hospital admission, it must be documented in the client's medical record. Question number 49. The nurse provides home care instructions to the mother of a child with a diagnosis of chickenpox about preventing the transmission of the virus. Which is the best statement for the nurse to include in the instructions? A. Isolate the child until the skin vesicles have dried and crusted. B. Ensure that the child uses a separate bathroom for elimination. C. Bring all household members to the clinic for a varicella vaccine. D. Request a prescription for antibiotics for all household members. Answer: letter A. Isolate the child until the skin vesicles have dried and crusted. Chickenpox is caused by the varicella zoster virus. The communicable period is from 1 to 2 days before the onset of the rash to 6 days after the first crop of vesicles, when crusts have formed. Transmission occurs by direct contact with secretions from the vesicles or contaminated objects, and via respiratory tract secretions. It is not transmitted via urine or feces. The recommended preventative schedule for receiving the varicella vaccine is at 12 to 15 months of age, first dose, and 4 to 6 years of age, second dose. It is not administered at the time of exposure to the virus. Antibiotics are not used to treat a viral infection. Rather, they are used for treating bacterial infections. Priority nursing tip: the skin is the first line of defense against infection. Altered skin integrity can lead to a skin or systemic infection. Question number 50. An older adult client has been identified as a victim of psychological abuse. Which action by the nurse is the priority nursing intervention? A. Obtaining mental health treatment for the client. B. Adhering to federal mandatory abuse reporting laws. C. Notifying the caseworker to intervene in the family situation. D. Removing the client from any situation that presents immediate danger. Answer: letter D. Removing the client from any situation that presents immediate danger. The priority nursing intervention is to remove the abused victim from the abusive environment. Options A, B, and C may be appropriate interventions but are not the priority. Priority nursing tip: older clients most at risk for abuse include individuals who are dependent because of illness, immobility, or altered mental status. Question number 51. A client with a diagnosis of leukemia asks the nurse questions about preparing a living will. Which recommendation from the nurse should be the best method of preparing this document? A. Talk to the hospital chaplain. B. Obtain advice from an attorney. C. Consult the American Cancer Society. D. Discuss the request with the primary healthcare provider, or HCP. Answer: D. Discuss the request with the primary healthcare provider, HCP. Living wills are legal documents known as advance directives wherein the client delineates the withdrawal or withholding of treatment when the client is incompetent. Living wills should not be confused with a will that bequeaths personal property and specifies other actions at the time of the client's death. The client starts the process of writing a living will by discussing treatment options and other related issues with the HCP. In addition, the client should discuss this issue with the family. Although options A and B may be helpful, contacting them is not the initial step because both professionals lack the medical information the client needs to make an informed decision. However, the lawyer may be involved after discussion with the HCP and family. The American Cancer Society may have pertinent information on living wills, however, the information is not individualized to the client's needs. Priority nursing tip: a living will lists the medical treatment that a client chooses to omit or refuse if the client becomes unable to make decisions and is terminally ill. Question number 52. Which clinical situation should the nurse identify as an example of slander? A. The primary healthcare provider tells a client that the nurse does not know anything. B. The nurse tells a client that a nasogastric tube will be inserted if the client continues to refuse to eat. C. The nurse restrains a client at bedtime because the client gets up during the night and wanders around. D. The laboratory technician restrains the arm of a client refusing to have blood drawn so that the specimen can be obtained. Answer: letter A. The primary healthcare provider tells a client that the nurse does not know anything. Defamation takes place when a falsehood is said, slander, or written, libel, about a person that results in injury to that person's good name and reputation. Battery involves offensive touching or the use of force by a perpetrator without the permission of the victim. Assault occurs when a person puts another person in fear of a harmful or offensive act. Priority nursing tip: a tort is a civil wrong, other than a breach in contract, in which the law allows an injured person to seek damages from a person who caused the injury. Question number 53. A client with a diagnosis of subarachnoid hemorrhage secondary to ruptured cerebral aneurysm has been placed on aneurysm precautions. To promote safety, the nurse should ensure that which intervention is provided to the client: A. Liquid diet, B. Enemas as needed, C. Help with ambulation, D. Daily stool softeners. Answer, letter D, daily stool softeners. Aneurysm precautions include a variety of measures designed to decrease stimuli that could increase the client's intracranial pressure. Stool softeners should be provided, but enemas should be avoided. Straining at stool is contraindicated because it increases intracranial pressure. Other measures to decrease stimuli include instituting dim lighting and reducing environmental noise and stimuli. The remaining options are not related to minimizing stimulation. Priority nursing tip: an early sign of increased intracranial pressure is a change in the level of consciousness. Question number 54. The nurse is about to administer a prescribed intravenous dose of tobramycin when the client reports vertigo and ringing in the ears. Which action should the nurse take next? A. Check the client's pupillary responses. B. Hang the dose of medication immediately. C. Give a dose of droperidol with the tobramycin. D. Hold the dose and call the primary healthcare provider, HCP. Answer, letter D, hold the dose and call the primary healthcare provider, HCP. Tobramycin is an antibiotic, aminoglycoside. Ringing in the ears and vertigo are two symptoms that may indicate dysfunction of the eighth cranial nerve. The nurse should hold the dose and notify the HCP. Ototoxicity is a toxic effective therapy with aminoglycosides and could result in permanent hearing loss. There is no need to check the pupillary response. Administering the dose would be an unsafe response. Priority nursing tip: the client with vertigo is at risk for injury, therefore, safety is a priority. Question number 55. The nurse is preparing to administer prescribed amiodarone intravenously. To provide a safe environment, the nurse should ensure that which specific safety consideration is in place for the client before administering the medication. A. Oxygen therapy. B. Oxygen saturation monitor. C. Continuous cardiac monitoring. D. Non-invasive blood pressure cuff. Answer, letter C, continuous cardiac monitoring. Amiodarone is an antidysrhythmic used to treat life-threatening, ventricular dysrhythmias. The client should have continuous cardiac monitoring in place for safety, and the medication should be infused by intravenous pump. Although options A, B, and D may be in place for the client, they are not specific items needed for the administration of this medication. Priority nursing tip: electrolyte and mineral imbalances can cause cardiac electrical instability that can result in life-threatening dysrhythmias. Question number 56. During the admission process of a client being admitted for surgery, the client asks the nurse if a living will, prepared 3 years ago, remains in effect. Which response is most appropriate for the nurse to provide the client? A. Yes, a living will never expire. B. You need to speak with an attorney. C. I will call someone to answer your question. D. If it accurately reflects your situation and wishes. Answer, letter D. If it accurately reflects your situation and wishes. The client should discuss the living will with the primary healthcare provider, HCP, on a regular basis to ensure that it contains the client's current wishes and desires based on the client's current health status. Option A is incorrect. Although the client can consult an attorney if the living will must be changed, the accurate nursing response is to tell the client that a living will should be reviewed. Option C is not at all helpful to the client and is, in fact, a communication block and places the client's question on hold. Priority nursing tip: on admission to a healthcare facility, the nurse should determine whether an advance directive exists and ensure that it is part of the client's medical record. Question number 57. The nurse reviews wound culture results and learns that an assigned client, has methicillin-resistant Staphylococcus aureus, MRSA, in a wound bed. Which type of transmission-based precautions should the nurse implement for this client? A. Enteric precautions, B. Droplet precautions, C. Contact precautions, D. Airborne precautions. Answer, letter C, contact precautions. Contact precautions include standard precautions and require the use of barrier precautions such as gloves and goggles. Contact precautions are used for clients who have diarrhea, draining wounds, or methicillin-resistant infections. The goal of these precautions is to eliminate disease transmission resulting either from direct contact with the client or from indirect contact through inanimate objects or surfaces that the pathogen has contaminated, such as instruments, linens, dressing materials, or hands. Enteric precautions are initiated if the organism is transmitted via the gastrointestinal tract. Droplet and airborne precautions are used if the organism is transmitted via the respiratory tract. Priority nursing tip: handle all blood and body fluids from all clients as if they were contaminated. Question number 58. The nurse is caring for a client immediately after a bronchoscopy. The client received intravenous sedation and a topical anesthetic for the procedure. Which priority nursing intervention should the nurse perform to provide a safe environment for the client at this time? A. Place pads on the side rails. B. Connect the client to a bedside ECG. C. Remove all food or fluids within the client's reach. D. Place a water seal chest drainage set at the bedside. Answer, letter C. Remove all food or fluids within the client's reach. After this procedure, the client remains NPO until the cough, gag, and swallow reflexes have returned, which is usually in 1 to 2 hours. Once the client can swallow and the gag reflex has returned, oral intake may begin with ice chips and small sips of water. No information in the question suggests that the client is at risk for a seizure. Even though the client is monitored for signs of any distress, seizures would not be anticipated. No data are given to support that the client is at increased risk for cardiac dysrhythmias. A pneumothorax is a possible complication of this procedure, and the nurse should monitor the client for signs of distress. However, a water seal chest drainage set would not be placed routinely at the bedside. Priority nursing tip: complications after bronchoscopy include bronchospasm or bronchial perforation indicated by facial or neck crepitus, dysrhythmias, hemorrhage, hypoxemia, and pneumothorax. Question number 59. A client with a history of silicosis is admitted diagnosed with respiratory distress and impending respiratory failure. The nurse should plan to have which intervention supplies/equipment readily available at the client's bedside to ensure a safe environment? A. Code cart. B. Intubation tray. C. Thoracentesis tray. D. Chest tube and drainage system. Answer, letter B, intubation tray. Respiratory failure occurs when insufficient oxygen is transported to the blood or inadequate carbon dioxide is removed from the lungs and the client's compensatory mechanisms fail. The client with impending respiratory failure may need intubation and mechanical ventilation. The nurse ensures that an intubation tray is readily available. The other items are not needed at the client's bedside. A code cart is used for resuscitation. A thoracentesis tray contains the necessary items for performing a thoracentesis. A chest tube drainage system is used to treat a pneumothorax. Priority nursing tip: for the client with respiratory failure, mechanical ventilation is needed if supplemental oxygen cannot maintain acceptable PaO2 and PaCO2 levels. Question number 60. The nurse is preparing to administer a first dose of prescribed pentamidine, isethionate intravenously to a client. Before administering the dose, which safety measure should the nurse consider for this client? A. Assign to a private room. B. Establish a supine position. C. Place on respiratory precautions. D. Assist to a semi-Fowler's position. Answer: letter B. Establish a supine position. Pentamidine isethionate is an anti-infective medication and can cause severe and sudden hypotension, even with administration of a single dose. The client should be lying down during administration of this medication. The blood pressure is monitored frequently during administration. Assigning to a private room, instituting respiratory precautions, or assisting to a semi-Fowler position are all unnecessary interventions. Priority nursing tip: pentamidine isethionate may be prescribed to treat opportunistic infections such as pneumocystis jirovecii pneumonia. Thank you for watching and listening. Please subscribe and click the notification bell to be updated for more videos.